before about routine flushing protocols, making sure that the lines are flushed so that they're patent and they're cleaned. And making sure that they're not occluded. Strict aseptic techniques during dressing changes and access. Those are all big policies.
Hey out there, welcome back to the Nursing Home Abuse Podcast. My name is Rob. I'll be your host for this episode. Today we're talking all about PICC lines, what PICC means, what the thing does, how to make sure that the people that have them are okay. We're certainly not having that conversation alone. No way that I could talk about PICC lines by myself. So that's why we have the fantastic Alice Darby on to walk us through that process. But first, it's time for the nursing home regulation question of the week and your opportunity to win the Nursing Home Abuse Podcast mug. Gene, can we show everybody the mug? That's a beauty right there. That's a beaut. You can win that. How do you do that? One might ask, and you probably did in your mind, is you go to our TikTok and you find the question of the week video. How do you know this particular question of the week video from all the others? Well, you're going to look for the thumbnail that features, I don't know how this is going to work, Gene. I don't know what you're going to show people, but look for GeoCities. You're going to look for a thumbnail that features GeoCities. And GeoCities was in the mid to late 90s. I want to say it was almost like a social media platform, but GeoCities was a place where you could go and you would be given, I think, 3 or 4 meg of storage, and you would have your own website. So it was like geocities.com/sunsetstrip/whatever/37441 or whatever. And that would be your website. And people would have like X-Files fan websites. Like I think I had my band's website on GeoCities, but that consumed my life for a long time in the late 90s was GeoCities, social media platform before almost like right at the start of the internet. But anyway, you are going to comment your answer to the question of the week and input or comment your favorite social media platform. My favorite social media platform ever is GeoCities, which no longer exists. And probably, even though there was like 1 million participants, it probably is not even a gig of information. Because I mean, literally, I think you got 3 meg of data to work with. So randomly, we will select a winner, announced at the end of the week on TikTok and at our website, which is schenkfirm.com/podcast/giveaway. The prize ships at the end of the month. Good luck, everybody. All right. So I think the difficulty level this week, folks, is going to be hard. I'm going to say this is a difficult one. So if you get this right, I'm going to let you doom scroll on your favorite social media platform for, I don't know, let's say a couple hours today. So if you get it right, you get to doom scroll for a little bit. Under 42 CFR 483.35 I-4, the facility must maintain the number of nurse hours worked each day for how long? Is it A, 18 months, B, 1 year, or C, 6 months? And that answer is A. The nursing home has to have the data that shows how many nurse hours are worked, and that's RNs, LPNs, and CNAs each day, and hold on to that information for at least 18 months. All right, so let's get into the meat and potatoes of the episode. Today, we are talking about PICC lines, but we have a fantastic guest to help us with that conversation. We have Alice Darby on. Alice Darby is an RN, BSN, LNC, and is a seasoned nurse and legal nurse consultant with over 25 years of experience in critical care. She currently serves as a vascular access specialist at Emory Healthcare and leads AKD Legal Nurse Consulting, assisting attorneys with medical record review and expert witness services. Her expertise spans pediatric, neonatal, and adult intensive care. Outside of work, Alice enjoys cooking, gardening, traveling, and values lifelong learning, and was a heck of a first base player in her softball league as a kid. And we're so happy to have Alice on. Allison, welcome to the show.
Thank you, Rob. Thanks for
So
having me.
no problem. Everybody kind of gets a softball at the beginning. You get one, you get the opening wind up, super easy. We're gonna start you off that way. What is a pick line?
Wow. Nice one. I thought it was going to be hard. And I used to play softball too.
Uh-oh.
Okay, a PICC line. A PICC line is a peripherally inserted central line catheter. It is a, I like to say the regular IVs that we place that you can go into the ER and they place a nice little IV. They're about 2 inches, 1 to 2 inches. I want to say that. But a PICC line can be up to about 50 centimeters. Okay. So, what is that? About 25 inches or so. We cut them based on some measurements that we take that start from the upper arm and then they end all the way up to a place in now outside of your heart called the superior vena cava.
Oh wow.
So,
Okay.
yep. Yeah,
So
that's
what
in short.
and it's the that's the short version. So what do
Correct.
we do? Like why is somebody getting a pick line?
A PICC line would be placed for patients that require central medication centrally, given to them centrally, like antibiotics, chemotherapy, um, TPN or total parenteral nutrition, if people can't eat. If patients need to be discharged with antibiotics or whatever fluids or whatnot to go home, doctors will prescribe will order a PICC line for the patient to go home with it and be able to be discharged to home or a nursing home so that they don't have to remain in the hospital.
I see. So it's um like a continuing IV, like but a
Correct.
little more complicated, I guess.
Yeah, it's a more complicated IV. Correct. It's and if they want to draw blood from there, they can do that as well. A lot IVs, regular your standard IV after perhaps the first or second use, they don't draw back anymore.
So like when you're talking about putting one in, okay, and
Correct.
maintaining it, is that something that only a physician does? Are nurses doing this?
Nurses are doing it. I am a PICC line nurse in the hospital. They can place them in nursing homes. Um, Outpatient procedure rooms, but I place them specifically in the hospital.
Is there any type of special training that's required for that?
The training that is required to become a PICC line nurse starts from you learning how to place an IV, a regular peripheral IV. Then after the peripheral IV training, then you after some time, give it probably about a year or so, when you're skilled, then you learn how to place an ultrasound IV. After the ultrasound IV, then you learn how to place midlines, which is a it's a shorter version of a PICC line, but a longer version of a regular standard IV. And then after you're skilled in learning how to do that, then you will advance into learning how to do a PICC line.
What is the like what how long is a typical pick line in?
They can be in for upwards of a year.
Oh wow.
Physicians, correct. If there are no infections, any line infections, any occlusions, any malpositions, if it doesn't get malpositioned instead of going into the superior vena cava, it goes into your neck or gets shortened or disturbed in any way, it can stay in for upwards to a year. Physicians typically will order them for patients if they require medications greater than about 4 weeks.
Is this appropriate for somebody that's mobile? Like, I mean, are these people like just bedridden? You know what I mean? Like, or because if
No,
in my mind, it feels like it would be easy to move it around or mess it up if you're moving.
no, sir. It is nice and stabilized with um, um, a little. It's called a stat lock with a lock that is placed on your skin, and then with a dressing on top of it as well. And it is nice and secure. Nice and secure.
What are there?
People walk around with PICC lines and you don't even realize it.
I guess so. I guess I've
Yeah.
learned something new
Yeah.
every episode. So okay, so then what sounds great. What are some of the risks involved in a pick line then, other than it like moving where and it shouldn't be? Like what are these some of the risks?
The risk involved in having a PICC line.
Correct.
So one of let's see, the some of the risks would be phlebitis, where you get infection of inflammation of the vein. Okay, thrombosis, which would be a blood clot in the vein. Um, Catheter occlusion, if the people taking care of the PICC lines are not flushing them per policy and per protocol, then they will occlude. And like I mentioned before, the malposition, if for with for any reason the pig itself inside was to migrate into a different location of the body, then that would be another situation. Or actually, the biggest one would be infection. If it's not taken care of properly, if it's not flushed and cleaned properly, if the dressings are not changed as they should be, um, then that would be a problem.
If we're looking at it, what dressing does it need? Like what is the I guess the wound site look like?
The wound site is so you have your PICC line that's inside of your arm,
Hmm.
and then you have your little lock that locks it in place. And then after that you put a clear dressing called a tegaderm on top of it. And that's it.
So
That's
then
it.
I guess from the actual from that standpoint, you're just looking for signs and symptoms of infection, like if the
Correct.
skin is red, things like that.
Correct. Correct. If there's swelling, if there's redness, if there's drainage of any sort, then that would be an issue.
So I mean, it sounds like I mean, the other than just looking, okay, it looks good, like you're really not doing anything. Like you're not. There's no maintenance involved in it.
There is no maintenance from the patient. However, we require that the PICC line itself uh, is looked at by a skilled nurse, a
Uh-huh.
registered nurse, every day, couple at least twice a day, to make sure that there's the dressing is intact, clean, dry,
Right.
and intact.
Hmm.
There's no drainage. There's no signs and symptoms of infection. So making sure, and also that it remains intact. It's sometimes if you have a confused patient, they might pull on it nicely, and it might get out.
I see. But it doesn't have to be cleaned, or am I wrong about that? You're like does it need to be flushed out or
It does. It does. It does. In per policy, every hospital has its own policy, but it should be generally speaking, it should be flushed between every medication and or once a shift by a registered nurse. And when they flush it, they also clean the little hub where the syringe and the saline meet, and they clean it for 20 seconds, and then they flush it,
and
making
that
sure that the line is patent.
sure, sure. Okay. And so, and again, all of this is
Mhm.
nursing. Like this wouldn't be a
Correct.
nurse aide. This would be a nurse or higher.
This is not a nurse's aide. This is a registered nurse or higher.
I see. Okay. So, Alice, you mentioned policies. So, what would be kind of like the typical policy with respect to PICC lines in a nursing home?
A big one would be staff education. Um, a staff typically does annual competencies in relation to their specialty, such as PICC lines. The floor nurses would also make sure that they know what to do, as far as assessing them as well. That is making sure that they're competent in assessing how to assess and how to address a PICC line with an infection, how to address a PICC line that has been dislodged out of the arm, things like that. Okay. Another one would be a policy for dressing changes. Uh, Dressing changes need to be done as every 7 days or as needed if it's soiled. by a registered nurse that is skilled in PICC line dressings. That's a whole nother thing.
Mhm.
Okay. Routine, like I think I said before about routine flushing protocols, making sure that the lines are flushed so that they're patent and they're cleaned. Um, let's see, and making sure that they're not occluded. Another one would be strict aseptic techniques during dressing changes and access. Those are all big policies.
When you say patent, what's patent mean?
Making sure that that it's clear.
I
If
see.
when we attach the saline, that we can flush it and it moves freely.
I see. Um,
Mhm.
I got one final question. What position did
Yeah.
you play when you played softball?
Oh, first base. Oh, you're
First
taking me back
base?
to third. Yeah, first base. You're taking me back to third through sixth grade.
Oh my goodness. Okay. So
Yeah,
like so did you play in a league, I guess?
I did travel ball.
Gee, wow, travel. So you must have been
Yes,
pretty good.
I
You
was
must
pretty good. I was pretty good.
So you were if you're a first base, that means you were the heavy hitter, I guess. Like you were
I
the
was, and I could catch.
Okay, well there you go. Okay. Well,
Yes.
Alice, we really appreciate you coming on the show and sharing your knowledge with us today.
Thank you so very much. I appreciate you.
Well, folks, I hope you found this episode educational. If you have an idea for a topic that you would like for me to discuss, please let me know that. If you have an idea for someone you'd like for me to talk to, please let me know that as well. Be sure to enter to win the Nursing Home Abuse Podcast mug. And new episodes come out every single Monday. And with that, folks, we will see you next time. Thanks for tuning in to the Nursing Home Abuse Podcast. Nothing said on this podcast, either by the host or the guest, should be construed as legal or medical advice, nor is intended to create an attorney-client relationship between the host or their guest and the listener. New episodes for now are available every other Monday on Spotify, Apple Podcasts, or on your favorite podcast app, as well as on YouTube and our website, nursinghomeabusepodcast.com. Again, that's nursinghomeabusepodcast.com. See you next time.